can I just expand on that, because what I was just jotting notes down as you were talking, because that concept of uniqueness as individuals, people can grasp that we're all unique, and I can imagine and have experienced when you go into a healthcare professional, they've got their tick boxes. And they're going down their tick boxes, so that bit's not very unique. And I can imagine in the role where you experienced, where you were being the translator as well, not only was there the complexity of a diagnosis and the individuality of the individual being diagnosed, but you've also got the communication barriers and the uncertainty and the fear and all those other things that were playing at it when you were in that translator role. So it's no wonder that you saw the depth into those layers of I'm going to call it the miscommunication that was going on. So just to help people understand, and I think that's sort of explaining that way with the tick boxes and all of the potential problems. Can you give us a bad example or a typical example that's not quite good enough from that communication perspective, and then sort of talk us a little bit more through that? I'm sort of looking for what's commonplace until you go into somewhere and actually get them to understand, and it transforms. What's the bit before the transformation?
I can give you an example of one of the cases that I had, because I've written the initial article on the WWYP Approach, which was published in a medical journal, and I give this example there because I could with the specific patient. It was this lady who walked into my office. That's before having my virtual office. I had a physical office. And she was obviously obese, and she wanted to lose weight. So we went through all the medical history and the background, and then, in the initial meeting, I always say that 90% of the time is the time for the patient or for the client. This is when they have to tell their story, but I have to know how to retrieve the information. So I used the approach, and she told me that she's been to every dietitian in town. She registered in every gym. She did everything, and somebody told her about me, so she came to me. So I let her speak, and through the questions that I asked her, which the purpose is to create the correct platform for the other person to open up and share information. She said, I would like to stop you here, and I would like to share with you something that I discuss only with my psychiatrist. And I said, what is it? She said, I've been an abused child and an abused wife. So that piece of information changed the diagnosis. Because if she hadn't shared this, or if I didn't bring her to the comfort zone to share this information, I would have just given her a diet regimen and another diet in her hand, and she would have walked out and we wouldn't have done anything, really. But having that piece of information, I knew that I had to work with her on other domains before she even started thinking of dieting. So the whole diagnosis changed, and the whole path of treatment changed. And this was, together with some other pieces of information, was her own unique diagnosis. So that is the person I needed to work with, not an obese person, male age so and so.
That changes it dramatically when you share that story, because you're literally unlocking the secret code to that unique person's transformation, in essence. And you don't know that unless you've been able to make somebody very, very comfortable, and they're opening up in that an incredibly vulnerable way.
Exactly.
one of the questions that I did actually have down for you, and it's probably a good time to sort of share this, was around that the fact that some clients may not be ready to talk fully about it, and not necessarily tell the entire truth, which is obviously the case that had occurred with this particular lady as she'd been shopping and she'd been around, but people had not taken the time. They'd done the tick and flick or the tick box process, whereas you were able to have that client, that much more client approach using your system that enabled you to unlock the secret behind what was going to become her success.
Right,
Yeah.
right. Because we need to, if somebody knocks at our door, this means that they're asking for help.
Help, yeah.
Yes. And they are willing to talk, but having the correct approach of communication from body language to tone of voice is so key in bringing out all the information. So that's very, very important.
Yeah.